This is the Situation Room, the only way to start your day.
But you know what I'm saying. And here we are getting into a conversation that I see is going to be an interesting one. You'll understand that in a minute. World Sight Day. Today is the 9th of October. And we're having a conversation into this. And when we say sight, the one for seeing. Two guests join us in the studio this morning. Dr. Dorothy Mutie is an ophthalmologist at the Ministry of Health, and also Peter Milo is the country director for the Fred Hollows Foundation in Kenya. Good morning to you both.
Good morning.
Welcome to the hot seats of the Situation Room. Of course, looking to World Sight Day. It's today, right?
Yes.
It is today, the 9th of October. And just before we get into that, we would like to have you look into a proverb that Dennis will share, and he'll let you know what he wants you to do with that.
You know, the proverb today talks about eyes as well, eh? Mm-hmm. But let's go to the country that we're getting this proverb from. It is Togo. And when we talk about Togo, it is bordered by Ghana, we have Burkina Faso, and it is a country that is big on matters to do with agriculture. So maize, cassava are some of the products that they grow and continues to push the economy. But let's go to the proverb. A man does not know he has pepper in his eyes. A man does not know he has pepper in his eyes. How would you interpret that, Doctor?
A man does not know he has pepper.
In his eyes.
In pili
pepper, pili.
In his eyes.
Yes.
Interesting. How would I interpret that? That's quite deep. It makes me think of that what bothers you, or something that bothers you, you may not realize that it is present, or because pepper really ideally is very irritating. Really, you would expect anyone to feel the effect. So if they are not, if they don't know, then they are overlooking something. They are probably not aware of themselves. They are not aware of what's going on with themselves. Probably more concerned about other people. The way we say, they are more concerned about the speck in the other person's eye than the log that's in their eye. Yeah. That's my take for now.
And you, Milo?
All right, yeah, that's an interesting proverb from Togo. But I can relate with our sector and with in the eye health space. And Dr. and to all Kenyans, last year we supported the Kenyan government to do an assessment called the Rapid Assessment of Avoidable Blindness. And the leading causes of why people do not go to seek for care was the unfelt need. The fact that you have paper in your eyes and you are unbothered to do it, it means it's something that you should do, but because it does not kill you, you leave it to progress. But what that means then, in that situation, and it's a discussion we are looking forward to, is that unattended, the paper in your eyes, if you are a man, it means you are not able to be economically productive. If you are a child, you are not able to go to school. So it means then it's something that you are failing to attend to, but it is affecting your socio-economic productivity. So that is how I look at it.
Well, that's deep.
Yeah.
Yeah.
Okay, so World Sight Day. Is it like saying happy birthday? No?
Kind of.
Okay.
Because we are really commemorating, or rather, not quite commemorating, it's more of making aware. You know, happy birthday, you're remembering the day you were born and so on. But for World Sight Day, it's an opportunity to make the world aware of eye health matters that affect our eyes, which are often ignored, just like what he has said, that paper. And many times, most people will actually put aside issues to do with their eyes and concentrate on something more. You can be sure if you have a toothache, that will take you to hospital even at night. But many people often will ignore eye matters until they are until it's very late. And that's why World Sight Day, it's a day for advocacy, a day to remind people your eyes are important. Take care of your eyes. And the amazing thing is that 80% of the causes of visual impairment or blindness are actually treatable or preventable. And so when we think about that, then why do we still have quite a large number of people affected? So World Sight Day exists to bring that awareness to everyone as an individual, but also to decision makers, people who are involved in making policies, in allocating resources to ensure, towards access to healthcare and so on. So that's why World Sight Day is celebrated world over, and as in Kenya, we are not left behind. Yes, that's why World Sight Day exists every second Thursday of October.
Yeah. So,
Yes.
Milo, it is a big day. For some of us who wear glasses, we know what that means. We know what that means. But even while at it, how does Fred Holo Foundation now get into this space?
Okay, that's a good question. And just to rider into what Dr. Mutia said, and as I come to that question, today the theme is Love Your Eyes, and the sub-theme is putting eye health at the heart of decision makers. And the Fred Holo Foundation is a global organization that was founded over 35 years ago. And its main purpose and mission is to end avoidable blindness. In Kenya, we've been present since the year 2004, and we are working with the national government, the Ministry of Health, and 22 counties. The foundation, all these years, has been focusing on strengthening the high health system in Kenya by focusing on 4 critical areas. That means supporting treatment. As I said, the leading causes of blindness, according to the rapid assessment of avoidable blindness, are 4 causes. And these are cataract, and this is where you find eyes are cloudy. Like what you're wearing, and myself and Dr. Mutia and all of us in this room, is a refractive error, and that's why you need sunglasses. And then the other leading cause is glaucoma. And then there's trachoma in trachoma endemic counties. So the work of the foundation is support treatment, and for example, in the last 5 years, from the year 2020 to 2025, we supported the government of Kenya, counties and the national government to screen close to 1.4 million Kenyans and provide support treatment for cataract surgeries in excess of 50,000, and for glasses reading, which children requires, and young people and everybody to do their work. We've done donation of close to 28,000 eyeglasses. But more important, we also support government in terms of policy, for example, the National Eye Health Strategy, and we are focusing support around the eye health policy, because at the end of the day, all this needs to be anchored in a robust healthcare system. So that is the work that we've been doing. And then another important aspect is that, and I think is an important point for us to note today, eye health is no longer a clinical problem, but is a development issue. And why do we say that? There is evidence that shows a child who is unable to see and they can get their surgery, they are frustrated to learn because they cannot see the blackboard, they cannot attend to their schooling. And that also leads to poor school attendance, poor education outcomes. There's that laborer or that person who would need glasses for them to either to drive a car to do their job. And that is where we talk about the economic productivity. But the last point that is very important, for every person who is blind and something can be done, it means they have a caregiver. That means a wife, a son, a daughter has to not to go to do work to look after you. So the work we are doing is to supporting care and treatment and enabling environment to allow free the caregivers to go and do their work. And that has been very empowering. And we commit to do that in the next 10 years as we work with the government and communities in Kenya.
Some of the things that you mentioned, and I'd like to come back to Dr. Mutia in a bit in terms of the physiological issues that we deal with. But you mentioned that some of these things are preventable.
Yes.
80%, I think, is the number that you gave.
Yeah.
I mean, okay, I'm sorry to use the word, but it's ridiculous.
Yeah.
That if 80% of the issues that we face today can be preventable, and then you went on to mention things like glaucoma, trachoma, and all of this. If they're preventable, why aren't we preventing them?
Okay.
Well, we'll start with you, Milo, and then we can come to you, Dr.
Okay.
All right. So I'll give it up it from a partner point of view. It's true, 9 out of 10 people who have blindness it's preventable. And that's why we talk about 90% of the blindness is preventable. But there are key barriers that are preventing this from happening. One of the biggest one is adequacy of geographically and well-distributed workforce for eye care. She just told you she's an ophthalmologist. There are very few of them. And also we also need other eye care workers for you to do surgery or treatment. You need a multidisciplinary teams of surgeons, nurses, clinic officers, and others. So that in itself is a space where we are having few health workers that we need. But the other important thing is also limited access. And when we talk about limited access, is for example, like the example you gave about Togo, but let's talk about Kenya. There are a lot of people who are not seeking care for eye care because there is what we call unfelt need. You know, many people, and I hope it's not the case that people say what you don't know does not kill you. But in eye care, if you leave your eye health unattended, it pushes you now to the blindness that is not reversible. So number one is about we need to increase community awareness, and here we are doing a lot of partnership and supporting counties and government with working with the primary health care, especially community health care promoters in terms of creating awareness. The other aspect, and you should know, is that equipment for eye health are very expensive, and therefore there are limited equipment in our health facilities. And the work we are doing and working towards in the 22 counties we are talking about, we are supporting a lot of work around equipment. And then the other aspect is about cost. I'm happy we have the Social Health Authority that is supporting a lot of the surgeries and treatment. But there are also other barriers to you accessing treatment, and sometimes it's about transport, economics, and others. So therefore, those are the big barriers that are preventing when these solutions are already available. So those are the big, from where I see it, but I'm sure Dr. Mutie from the ministry can highlight and provide more.
Okay, so I mean, we can ground some of these issues, can't we?
Yeah.
That I have a colleague here who says, "Well, I can't see," as in I said, "For how long?" He said, "Well, I mean, forever. I can't see, but I just don't want to get glasses." So it's a constant thing for I can't see. I've been in a vehicle with somebody who clearly can't see, and they're driving. They can't see, but they believe that if you squint a little bit, I can get where we're going, and so that trip is done, right? So it's years and years of this behavior where I can't see, but I don't want to wear glasses. It's cumbersome. It's this, that, the other thing. Are we doing a disservice? Are we damaging? We're going to get, Milo says, to a point whereby things are irreversible. Then talking about prevention area of things.
Yeah, absolutely. And you touch actually on a core aspect of the reason why so many people still have issues with eye health, the aspect of the unfelt need. If it doesn't bother, or not just about unfelt need. There's also the various myths and misconceptions about eye health. You've just talked about glasses. And often there's that whole lot of, a whole population that talks about, I don't want to wear glasses. What's behind that? There are myths around glasses, for example. A child who starts wearing glasses when they're young, they'll become blind. That's the thinking. Or that their eyes will sink. Oh no, this child, that kind of thing. No, my eyes, my features, I won't look nice and such. Yet, it is such a simple intervention that will actually make someone who is unable to see, and they become productive. So it's back to the beliefs that people hold, the myths that have been propagated. And that's why, as a ministry of health, one thing that's paramount is about just creating awareness of the different causes and the different interventions there are. For example, we talked about, Milo mentioned a few of the causes of what we call visual impairment or blindness. We say they are preventable because either there's a cure, or rather there's a treatment for it, or it can be prevented or steps taken earlier. For example, let's take cataract. Cataract is something that surgery can actually cure. You have your surgery today, in a few days, your vision is fine. Okay. So that's one. Refractive error, being short-sighted or having poor near vision, a pair of glasses sorts that out. Yet, many do not want to use that. But there is care available. When we talk about another cause of blindness, which I would like to highlight, is what we call diabetic retinopathy. We have a huge number of people who have diabetes. What they don't know, or many of them are not aware, is that diabetes can actually lead to blindness. And it stems from the care of taking care of the diabetic part of it, because if they don't take care of that, then one of the complications is actually poor vision. The eyes get affected, and by that time it's really their vision can we've reached a point where it's almost irreversible. Yet if that person earlier on had taken care of their diabetes, had gone for screening early, then potentially they would not have gone blind. So in essence, we are talking about belief system, then just our behavior, our health-seeking behavior as Kenyans. Yeah, you've just mentioned your colleague. Why are they not going to? Because they do not want glasses. Why don't they want glasses? That's what we should explore. This driver, what is it that what do they fear? What are the fears? And in fact, in a study we did some time back, glasses actually were availed to people. And these were just for near glasses. They were availed free of charge. People were told, you can come for your glasses. Do you know half of them didn't pick them? Yeah. And so we did a survey to ask, you saw that you needed, because actually they were very happy. They were able to read. Then, so they were asked, why didn't you go? And they were at no cost to you. Oh, I had no time. Very interesting, what I would call flimsy excuses. So it goes back to the behavior of the people, which means we still have a lot to do as a ministry, as partners, to address those concerns that people have around eye health. And of course, things that are deeply ingrained take time, but we can't leave them. We must take the steps to create awareness, continue creating awareness, and starting early. One of the things that we, or rather one of the partners, not really partners, we work very closely also with Ministry of Education, because in schools there is a school health policy. In it is also an eye aspect. So there have been efforts to try and to screen children while they're in schools, get them getting their eyes checked. Those who need glasses, those are availed. It's ongoing work, and there's still a lot of misconceptions again. You need glasses, but your parents say, no, you cannot wear glasses.
Why?
Yeah, there are parents who flatly refuse and say, no, my child cannot wear glasses. They will go blind, because they don't understand what really refractive error is all about. So again, so there's all that around the misconceptions.
So, Dr. there is also, when you talk about eye health, so there is opticians, you correct me if I'm wrong, and there are ophthalmologists.
Yes.
And most of the time you find someone has a cyst on the eye, and the next thing is, I'm going to see an optician, not an ophthalmologist. There is that clear difference that people do not understand where to go to at what point. Absolutely. Most of the time, whenever there is a problem with the eye, someone just thinks, I need to go to an optician for glasses. But maybe it is a bacterial infection that deserves an ophthalmologist to assess and give you necessary prescription.
Yeah.
Failure or absence of this information, how is it affecting need for healthcare?
You bring a very important aspect of eye health also. I think most Kenyans, I think it's human beings, we love shortcuts. We do not want to take the long haul. Oh, I will go queue, I will go, it will cost me a lot more. There's an optician right at the corner. And as Milo mentioned, some of the health facilities where you have an eye health worker may be a little of a distance away. So often it's that, I can get help. Or the other example is, I can go to a chemist, get an eye drop for my infection. And that is a huge area that has been, that area that has really, really impacted on both getting people the right care and also leading to an avoidable unnecessary blindness. Really. So let me put it, it's important for people to understand who gives what. Which eye health worker does what, so that you go to the right correct place. And as you rightly say, somebody has a bacterial infection, they go to the nearest place where really they may not get the correct help. The other thing is, among the eye health workers, as Mill also pointed out, eye health is about multidisciplinary work. You can't work alone. We work as a team. And ideally, every member of that team needs to know, this is my scope. So for this one, I need to escalate it to the next level. So unfortunately, we do find there are a bit of unscrupulous practitioners who will not do the right thing and instead capitalize on this person who has come with a bacterial infection and say, okay, I'll give you this eye drop, or you use glasses, you'll be fine. When actually that person's problem is more serious, like even glaucoma. And for many, now that I mentioned glaucoma, that's how many people have missed out on a diagnosis of glaucoma. So by the time they reach, say, an ophthalmologist, it's way late. So, yeah.
Okay, so how does glaucoma present? Because there are quite a number of people who today are blind.
Yes.
And the cause of that was glaucoma. But Milo, you talked about it being preventable to a certain extent. How does it present, and what numbers are we looking at in Kenya?
So I want to first circle to the question that he asked about the team, and then talk about the various, and then allow Dr. Mutie to kind of address the issue about glaucoma. But this is what happens. Every Kenyan, based on our healthcare system, the identification path is very clear. So it means that where communities live, if you go to your nearest clinic, they will be a health worker. And at that point, you don't need an ophthalmologist. An ophthalmologist is a high-level eye care worker.
Okay.
So the nurse at the facility near to you, they are able to screen you and refer you to the appropriate level of care. There are those conditions that are just requiring eyeglasses, and nurses and healthcare workers at that level will be able to provide that. But there are those conditions that require that once you are screened, and that's why we are talking about screening. Once you are screened, then the referral is for you to see a surgeon who requires to do the surgery. And cataract surgery takes only 30 minutes.
Okay.
Only 30 minutes. There are those that require, the condition does not require a surgery, but what you need is glasses. And this is where optician and optometrists come forward. So my advice to Kenyans today, whether in Nairobi and in the counties, please present yourself to their nearest health facility, and from there, then they will be able to be screened and referred to the appropriate level of care. So that is the pathway to making sure. Then the other one, and I think in terms of glaucoma, we must speak about the integration of the healthcare system. Most of the time, glaucoma will be identified in the diabetes clinic. So that means if you present there, they will screen you and identify these conditions, and then you are referred for treatment, which Dr. Mutie will be talking about in terms of glaucoma. Yes, but glaucoma needs to be identified early enough. If you don't identify early enough, then it's a condition you have to live with for a very long time.
What does it look like?
Yeah, interesting. Now, glaucoma is actually called the thief of sight, the silent thief of sight. The unfortunate thing is that we don't quite have a tool to screen it early enough. So ideally, for glaucoma, one must endeavor to have a full eye checkup, at least once every year or once every 2 years. And especially so if you're aged 35 and above, 5 years, and also if there's a family history of glaucoma. Part of the reason is because how glaucoma develops, it starts from the outer part of the eye. So it does not significantly affect vision, which is what is very obvious to most of us. So it starts from the outer part of the eye, and the inner eye, that is, and we don't see it. So, and then slowly progresses towards the center, the place, the central place that is enables us to see very clearly. So by the time that is affected, really there's nothing much we can do. However, if detected early, there are medicines and there's surgery to enable someone with glaucoma to actually live with it. Unfortunately, there's no cure for glaucoma. And that's something people need to be aware of.
Okay, sorry.
Yes.
Okay, so you can't tell that glaucoma is progressing as the person with the eye. but if you, as an ophthalmologist, did a test or
Yes.
screening, you could tell if
Yes.
there was progression of glaucoma.
Yes, yes.
Okay, you can see.
Yes.
All right.
Yeah.
And so what would you, I'm sorry, we're going into details, but what would you see that would tell you, okay, this is glaucoma?
Aha. The main symptom would be beginning to find that you're not able to see on the sides. You're walking straight, facing straight, and all of a sudden you realize somebody passed and you didn't see them. So it's about the peripheral vision. That's what starts getting lost. And that's the main symptom. Otherwise, beyond that, there's really no other symptom. Though there are other types of glaucoma that would present with pain, but those are very rare. Those are very rare, what we call angle closure glaucoma. But for the vast majority, it is what we call open angle glaucoma, and you lose peripheral vision without realizing. So you just realize one day, oh, I can see clearly straight ahead. But you see, as you're looking at me, you're seeing your surroundings, aren't you? You're aware of where Milo is seated, even though you're looking at me.
Yes.
That disappears with glaucoma.
So somebody with glaucoma, if I was sitting here, I wouldn't
Yes.
see Milo or Dennis.
Absolutely. Yes.
Oh, really?
Yes.
Without even having to move my eye, I wouldn't
Exactly.
be able to see.
Yeah.
Okay. All right.
Yes. Yeah.
Okay.
And that is the reason why, as she said, it is still the vision, is that you continue to see.
Yes.
But with the time, the field keeps on narrowing. And the reason why, and let's also link this to road accidents and others, there are a lot of pedestrians who will have knocked by a vehicle, or by a motorbike, by a cyclist. Not that they did not see, not that they are negligent to cross, it's because they are not seeing. And now that leads me to the other effects of not addressing eye health. Like I was following the reports for the National Transport and Safety Authority, NTSA, where we talk about in the year 2024, close to over 3,000 Kenyans lost their life. But they said part of that reasons why many accidents happens, it was poor vision. It could be with the pedestrian, it could be with the drivers and others. And the ramification of eye health are far-reaching. For me, from where I sit, and this is where we are saying is that eye health is no longer just a clinical disease, but is a socio-economic political agenda. Simply because if you address eye health and government invests in terms of resources, planning, and drawing more attention, then you're able to unlock a lot of potential in people in terms of labor, economics, improvement in school educational outcomes. There are many children, and I can remember of several in our programs whereby a child is frustrated. I think of a story of a girl, Michelle in Siaya, who was frustrated in high school. She's not able to read and see the board. But you know, the education system is progressing. But the day she was screened and identified the challenge that she had and she needed classes, she was able to enjoy her schooling and able to progress into what she wants to become in life. A young boy in Kilifi called Baraka Baluku, whereby he stays with a cataract that needed attention. But that was identified by a community health promoter, who we are calling the community volunteers. He was able to get his surgery in Kwale Hospital, a partner hospital that we work with. And this young man was able to go back to being a child. Children are supposed to play and to enjoy their schooling. So therefore, when we just talk about eye health as just a clinical condition, we forget that you need your sight for you to be productive. Like where we are here, we are able to work. In fact, nowadays we are talking about you don't need your glasses for just reading. We call it for near work. Near work means reading is part of it. Driving is part of it. You need just to continue with your business. And then there are a lot of people who are dragged to poverty because they are caregivers. Because you will realize a blind person needs another person in which for them to be helped. But there are options that are there, and we are seeing a lot of innovation in the work we do. And if you may allow, is that we are seeing a partnership with the ministry and the private sector and other stakeholders, whereby we are using mobile technology in what we are called peak vision, whereby some of this screening, by the way, and this is what I said, an ophthalmologist is a very highly skilled eye care professional, and we do not need to engage them for that level of screening. So therefore, a health worker with a mobile technology, with peak vision technology, then they're able to screen.
But do they have them?
So in West Pokot, we are doing successful work with that.
Okay.
In Embu, that is happening. And what are they using? They are using a mobile technology with a community health promoter. And what happens is that they are able to talk to you and go through a checklist of several questions and conditions, and even measure your visual acuity. And based on that, you'll get an SMS that says, now we found you, Dennis, you have an eye condition, you need, like, for example, go to Langata Eye Clinic, where you'll be able to get your treatment. If you don't go, then you get a reminder that reminds you you are referred and you did not go. And then the system is able to track you through to you being able to be scheduled for surgeries, for glasses and others. And what are we saying the technology is using? So you can see we are bringing that aspect of screening at the community level so that you have a very clear referral pathways, and that is a lot. So there are success stories in West Pokot and Embu, and we are looking forward to, in that partnership, to doing even more. So I think that what you are saying is that the technology exists. Is the awareness creation that we need to make sure that is amplified. And we also want decision makers. And today, as we are here, we also have legislators and senators who are going through their screening and getting their tested so that they can also appreciate what eye care means. And that's very important for us to know. Yeah.
Okay.
So I just want to read a question by one Christina A, who says, my daughter usually has tears coming from her eyes in the morning, but I don't have the courage to take her for screening. I'm scared of the results. It started when she was in class 6. She is now in Form 2.
Thank you. And that's a perfectly valid concern for the parent. Any parent wants their child really living a normal, healthy life. But they will also want them productive. And that's why she's concerned about the tears, right? But she says she's scared. What is she scared of? One of the things I think any human being would be scared of going blind. I think that is the first thing, that really you wouldn't want anyone going blind. And so one of the things that we really must get our population to understand is there are two things. There is blindness and there's what we call visual impairment. So blindness is a state where now you can no longer see completely, you need help. You need to be assisted to do your day-to-day work. But the visual impairment is conditions that affect your eye, not necessarily leading to blindness, but if not attended to, could potentially then cause vision loss. So the advice would be address your fear and say, let me act now. Let's address this tearing now and hopefully avert poor consequences of not acting. So it's again getting to the community, and has been highlighted. I think the current regime is really strong on community health promoters, and their training includes a module on eye care, which means then they are able to pick some of these conditions early enough and advise parents. And since they live in the community, they can talk one-to-one, one-on-one, try and understand, what are your fears? What are you fearing? Can I go with you to the health facility, so that then they can address those kinds of fears, and then the child hopefully will get help.
We both addressed matters to do with the community health promoters, and just how critical is their presence as we discuss this matter today. Just how critical are community health promoters in ensuring that these cases are captured early, and necessary attention is given to them, and treatment begins. Because most of the time you find, let's say in far-flung areas where you'd find an ophthalmologist isn't there, perhaps there's need for a referral. How does community health promoters then step in to bridge that gap and offer necessary advice for both of you?
So maybe we come to that case where we've talked about of a girl who has been tearing and for many years. My advice to the parent is they need to take the necessary step right now, which means they need to work. If she's in a day school, is that then they need to present themselves to the nearest health facility in their location. It could be a level 3 sub-county hospital, level 4, or county referrals, whereby they will need to screen. Because the moment we talk about eye drops, most likely the condition is whereby they are self-treating themselves. And those conditions have a solution. So I think for that particular case, they need to present themselves to the nearest facility. If she's in a boarding school, all schools that are boarding always have a matron. I think the correct thing is to do is to present to the matron, and the matron needs to refer the child to the nearest government health facility. So I think that's an important aspect. Community health promoters, and I think we can never overemphasize the role of primary health care. Community promoters are the people who serve a certain community health unit. So they are responsible for screening of health conditions within a community unit. And these conditions are many. Eye health is one. They screen for nutrition, malaria, for maternal and others, so that they are able to refer for that. So one of the things that the community promoters, they are our frontline soldiers. Therefore, it is important that we have adequate numbers, and there's very good progress in that. But the other aspect is that they are always working and employed by the county governments, all right? So therefore, county governments, as they have done, and in the 22 counties where we are working, and in all the 47 counties, we have community health promoters. So continuing to plan and budget for their stipend, for their resources, and the things that they need for them to do the primary healthcare work is very important, because they are the first people who will identify. They are the ones who will identify there's a mother here who needs maternity. But I always talk about the integration. You know, when we talk about eye health, sometimes it looks different. And I want to draw the parallels here. That mother and father, when they're in the clinic, they are patients. That mother and father, when they are in the school where their daughter and son goes to school, they are parents. Then that mother and father and son and daughter, we are in the farm, they are farmers. But basically, we are speaking about the same person. So therefore, there is need for that integration. So as they screen in a household for nutrition, maternal, malaria, and other conditions, eye care is part of that. But that support system networks, because we have always seen in terms of their facilitation for their allowances, for their training, and making sure that they are adequate and enough, that needs to continue. And that is what the government can do. A lot has been done, but more can be done.
Okay, so maybe I would combine this next question for you, Dr. Mutia, with one that comes from Calvin, who's on our streams as well. And he says his friend has been losing his sight for a while and has gotten to the point where he cannot read or write properly. So even if it's, it's up there. And that he's been to a facility where they've been told that there is nothing they can do. Could that be glaucoma? And I'm going to combine that with this question, whereby I can see a shop and it's got glasses in it, and I have an issue with my eye, and so I'm going to walk into that shop, and the optician who may be in the back end, I'm hoping that they will be able to find me a problem. Or I go to another one and they tell me the optometrist is in. Or they tell me that the ophthalmologist is in if I go to another one. Or they tell me that the ophthalmic surgeon is in. How are we differentiating between these four and what they do?
Thank you. Excellent question. So let me first address the concern, the one who's concerned about their friend. It's possible it could be glaucoma depending on their age. But there are other conditions that could actually potentially cause loss of vision, and that's why a comprehensive eye check would be important. And when we say comprehensive, that means full eye check. That, first of all, would help identify the actual cause and see if something can be done. Because as we progress, technology, new research is coming up. And so we are finding things that before we could do nothing about. Now, there's something we can do. So it's very important that he or she gets to a health facility where they can have an exam.
I need to say that the health facility that he's mentioned is actually quite for is a forefront facility that has
I
dealt with
see.
eye issues.
I see.
I'm not going to mention it, obviously.
That's all
because,
right.
it's one of the ones that we hear of a lot when it comes to eye issues.
All
so
right.
in that case, that might tweak things a little bit.
Okay, all right. In that case, all is not lost. One of the things that the other bit of awareness that we need to bring is that should vision loss occur, that's not the end of the world. We have rehabilitative services, and in Kenya, actually, we do have we have an agent. An organization called Kenya Society for the Blind that actually helps anyone now who has irreversible vision loss to they work together so that they can be able to navigate their own life, their personal life, as well as even vocational training. How then best can they continue with their normal life? So that would be the next best place. Not only that, and it's not just about people who are blind. We also have what we call low vision. We have low vision devices and centers that offer that. And these are devices that cater for those who have not completely gone blind. They still have some vision, which can still be useful. And they're given devices that can help them read, can help them actually go to school, can help them navigate life. So life is not lost, all is not lost. So I'd advise that there's help.
Okay.
They can find help. So let them not give up. And we can, if they can get in touch with the Kenya Society for the Blind, they can get help.
Okay. All right.
So in terms of the eye health workforce, so what are the differences? Yes. In the eye health section within the ministry, we actually have what we call the scope of practice guidelines, which outlines what each level can do.
Okay.
And as part of creating awareness, it's important that people know what's the level that this person can do, and they are obligated to escalate what they can't do to the next level. So if we start, let me start from maybe, do I say from the top? That is the ophthalmologist. Usually that is a doctor who has trained in medicine and has gone further to do eye care.
Okay.
So they can do surgeries, they can do, they can prescribe medication and all that. So that's an ophthalmologist. In Kenya, we also have what we call the ophthalmic clinical officers. Who support the ophthalmologists in identifying and treating eye conditions. Usually they will be found at level 3, level 4, even level 5 facilities. So they'll be like the first line person. So they'll see, and then what is more difficult, then they can refer to the ophthalmologist. So they work together that way. We have the optometrist. So the optometrist has training in what we call vision sciences. So they work on the vision aspect of it. They'll help in terms of identifying conditions that require vision therapy. They can help with people who have refractive errors, contact lenses, and so on. And they work closely also with the ophthalmologists. Finally, we have the optical technicians. This is the team. Once the optometrist, for example, has said you have a refractive error and you have no other issue, you need glasses. So then this is the team that will actually fabricate the glasses. We'll take the frame, make sure it fits, and then put the correct glasses. So I think with that understanding, we should be able to identify, I have a discharge, really who is the best person I should go to.
Okay.
Yeah.
Yes.
So Mila, I want us to look at the current world where we are. Your alarm in the morning is your phone. It's the first thing you wake up to.
Yeah.
It's the last thing you close your eyes to. So every day we are here, or you are on a machine. Babies at home nowadays, there is a cartoon there for them to watch the whole day. And exposures to the modern technology, how does that affect the eyes? As well as, let's look at how can Kenyans avoid problems associated with their eyes? What foods do they have to eat to reverse eye problems or conditions, if any?
Okay. So again, before I come to your question, and just to come to the earlier question, as a Kenyan, when you present yourself to a health facility nearest to you, the various pathways on who sees you, that is sorted by the referral system. If you need a surgery, you can be sure you'll be attended by a cataract surgeon or an ophthalmologist. If it's about glasses that you need, you'll be attended by optician or optometrist. So that removes the burden of trying to figure who needs to do what, because that in itself becomes too much. And then the concept in terms of workforce, we are saying, and this is why we are saying the community health promoters, they are doing screening before many years ago. That is what optometrists were doing. And what we are saying is that there are also eye health issues that have been in what we are calling tax sharing, whereby they are delegated to another cadre so that they are able to be attended to. So that is very important. Now, coming to phones and screens, they are here with us to stay, and we must learn to stay with them. But times have changed. So one of the things that we are talking about in terms of eye health, and also very much to do with school health, is that we need to encourage children also to have time off in terms of playing and all that. So one of the things that we need to encourage is also a healthy living, whereby we have to talk to parents to encourage children to go and play outside, to have healthy eating. That means fruits and all foods that are important. So that allows to remove that pressure to do with a lot of screen time, because you see, we are getting more screens in our life. And then the other one is that, like with the mobile phone, they are small. If you have opportunities to provide bigger screens for people to work, the better for them. So that is an aspect that we must continue to work with, but we work towards reducing the screen time exposure by introducing other aspects. And that's why you talk about games, outdoor activities, and all that. You remember a long time ago, it was parents calling children, come back from playing. You are playing too much, come. But with phones that have come, parents are finding a challenge to encourage their children to go and play, because that is very important, because that removes that exposure. We also need to deal with these things about a myth, because I know growing up where you'll find when a child is watching a TV, they move closer to the TV, and the parents or the guardian will say, you are going to spoil your eyes. What the child is doing by moving closer to this TV, they are doing accommodations so that they can see what is there. It shows there's a problem. Are we together? So those children, or they are telling us there's an issue, and that's why they are moving near or far. But the default is come away from that. So that is very important. But the other important aspect is to integrate eye health into the broader health and the other sectors. Remember the story I've told you about. The same person who needs glasses is the same person who needs them for doing other work. They are the same person who need them in schools. And therefore, like even when we talked about glaucoma, you address glaucoma from the diabetic clinics. That means there is screening that is arrested there. So that integration into the broader health is very important. And then to other sectors. And this is what I want to share with you today on this World Health Day. That shows in Kenya, there's a report that has been released today, which is talking about the value of good vision, the investment case for our health. It's a global report, but we today I want to share with you what it's saying about Kenya. And we are saying if Kenya invests in eye care, we are able to unlock $265 million US, which is close to 34 billion Kenyan shillings. That's a lot of money. But what does that investment come from? Where will that money we are talking about when you invest in eye, where will you get that? You'll get that money from occupational productivity. There are people who are not able, and I think this is even more profound for those people who do work that requires for them to get their wages on a daily basis. If you have poor vision, you lose income. So that means then you feel that. So the savings or the money you get is from improved occupational productivity. You talk about increased employment. There are people who actually don't have a job simply because they will not be able they have poor vision. And then there's also about schooling, education outcomes, school attendance. There is a child who, because they are not able to see the board, the system may not be understanding them. They are frustrated and they stay home. And the last one, which is very important, is the caregiver. I will tell you this. In all the 22 counties we work, and I know you've seen people who are blind. For any time you see a blind person, there are either two people. There's one helping them, and there's a blind person. So blindness leads to 2 or 3 other people not being able to do anything else. That means when you talk about avoidable blindness, that surgery of 30 minutes, the cataract, will free that person to continue with their life and you to continue to do what you are doing. So and then how does this happen for us to talk about this productivity? We must start seeing eye health not just as a clinical issue, but as an opportunity to unlock our economic productivity. And that's why we say we are putting decision makers at the heart of it. When we tell you about investing in eye care, it's the same way you can go and look for a development loan to come and improve your high health system and the healthcare system. Because I know we can take a loan or look for financing to do other tangibles, but there are things that you are not able to see, but they are very important. Indeed. So that investment in eye health as a socio-economic development agenda is very important. And then the modification we are talking about, where blindness has come and nothing has happened, there are assistive devices that allows you to continue
operating.
The best example I can, if you allow me, I spent a bit of time at Kenyatta University. If I use that as an example, if you go to Kenyatta University, you are also able to find students who are blind, who are navigating and going on in the campus unaided, because the university has put modification to allow you to continue with your life. And that is very important.
Indeed it is. And we could go on. I mean, there's so many questions still around eye health. But, you know, our time comes to an end. We must have you back to even look at some of these issues, because people want to know about, I mean, from LASIK surgery to other kinds of surgery and things that you can do. But, you know, time allows us to do just this. And it's been quite informative to then be able to look into some of these matters. It's World Sight Day. Love your eyes, essentially, is what we're saying. Do that today.
Yep.
Peter Milo is the country director of the Fred Hollows Foundation here in Kenya, and Dr. Dorothy Mutie is an ophthalmologist in the Ministry of Health. Thank you both for being here on this World Sight Day to open our eyes, literally, into some of these matters.
Thank you for having us.
Thank you.
Yeah.
Thank you for keeping it the Situation Room this Thursday morning. It is 10:01. Good morning.
Morning. Thank you.
The latest. This is the Situation Room, the only way to start your day.
5 bob